Welcome everyone to this Settle in Life session. My name is Dr. Soma Yusufi and I'm a consultant with the National Resource Center for Refugees, Immigrants, and Migrants. We are partnering with Settle In to offer a two-part series on healthcare in the US. Please remember when commenting during this live session that this event is not private. Please do not share any personal or confidential information. In part 1, last week we gave an overview of the different types of healthcare providers and services in the United States. That recording can be accessed on the Settle In Facebook page. In today's session, we will give a general overview of emergency care, emergency rooms, and calling 911. This session will be about 10 minutes. If you have any questions, please add those as a comment to this video or direct message us. Emergency care. Let's start with emergency care. Emergency care is available in hospital emergency rooms and provides treatment for sudden illnesses or injuries that might be life-threatening. You can visit an emergency room if you feel like your life might be in danger if you do not receive treatment immediately, or if you have a severe injury such as an open wound or broken bone. For example, if you cut your hand very deeply while preparing food and it's bleeding a lot, you may need to go to an emergency room to get stitches. Or if you are having chest pains and you are worried it's a heart attack. If you do not feel that you have a life-threatening emergency, you may visit an urgent care clinic or primary care providers instead. For example, if you have a persistent cough that does not get better after taking medicine, your primary care provider may help, or you can visit an urgent care clinic. For more information on urgent care and primary care, see part 1 of this live event series. Emergency rooms are open 24 hours, 7 days a week. When you arrive at the emergency room, be prepared to list your current medication, health history, health insurance card, and emergency contact number to the emergency room clerk. When you visit an emergency room, you may need to wait to receive care. Emergency care can be expensive. Most health insurance covers emergency care when there's an emergency need. If people do not have health insurance or cannot pay their medical bills from emergency care, many hospitals have staff who can work with them to come up with a plan. We will not cover health insurance in this live event, but if you have health insurance questions, please direct message us or leave them as a comment in this video. Ambulances. For some medical emergencies, you may need an ambulance. On the ambulance are people called paramedics. Paramedics are trained medical professionals who respond to medical emergencies. Paramedics may start treatment on location, or they may take you to the closest hospital emergency room if it's truly an emergency. If you cannot get to the hospital yourself and your life is in danger, the ambulance will take you to the closest hospital emergency room. For example, if someone is in a car accident or has fallen in their home and are unable to move, an ambulance would arrive and take them to the closest emergency room. Now let's talk about how to access emergency services. If you or someone near you is having an emergency, you can call 911 to request immediate assistance. You can call 911 anywhere in the United States and at any time of the day or night. Operators will respond 24 hours, 7 days a week. 911 is the same number no matter what city or state you are in. If you do not have a phone, go to the nearest person and say, "Emergency, call 911," so that they can call 911 for you. If you do not know English, you can still call 911. When the operators answer your call, you should say "No English," and then the name of the language you prefer, such as Dari, Pashto, Ukrainian, Russian. The operator can then get an interpreter on the line for you. This may take a while, so do not hang up. Whether you use an interpreter or not, The operator will ask you some information. Type of emergency assistance needed. The operators will ask you if you need an ambulance for medical emergency, a fire truck, or the police. If you do not specify which services you require, they will send all three. Information about you. The operator will ask your name, where you are located, and your phone number. Nature of your emergency. The operators will ask you to describe the emergency situation that you are experiencing. Then they will send you help very quickly. Do not hang up the phone unless they tell you to do so. What should I expect when I visit an emergency room? Emergency room visits can be stressful, but knowing what to expect can reduce that stress. Many things may happen to you while you are in emergency room. For example, front desk staff will ask you about your current health concern. A nurse will take your temperature, pulse, and blood pressure and ask you more questions about your health concern. After this, you may wait a long time, including several hours, before you see the doctor if your problem or illness is not severe. Since emergency rooms do not take appointments, they prioritize patients with the most severe injuries or illnesses. If possible, bring snacks, water, your phone charger to the emergency room as you may be there a long time. If your injury or illness is severe, you may be seen more quickly by a healthcare provider. The medical provider will examine you and decide what needs to happen next. This may be X-ray, blood work, or other tests. Once all the examinations and tests are completed, you will be told what they learned from the tests and what the next steps are. The doctors will determine if you need to be admitted to the hospital for further observation, tests, treatments, or if you can be sent home. If they send you home, they might prescribe you medicine and a referral to a specialist to continue care. After your emergency room visit, you should follow up with your regular doctor and let them know why you went to the emergency room and what the doctor said. They will most likely order all of the records from your visit so your medical file can stay up to date. Today's session covered emergency care and calling 911. In last week's session, we covered the different types of healthcare and healthcare providers in the United States. If you want to access a recording of this session, it will be posted to our Facebook page shortly after this session is completed. You can find the recording for part 1 on our page. For more information on patient rights and responsibilities, how to get interpretation, TB, latent TB, and more health-related topics, check out the Help Center. I would like to thank you for joining us for this Settle in Life event. We covered a lot of information. You can return to this recording after the event to review the information again. We also encourage you to follow the Settle in Facebook page for the latest information you need to know as you adjust to your life in the United States.